Hi, my name is Felicia LeKay, and I am a Grammy and Tony nominated actress, singer, advocate, and proud ovarian cancer survivor. I was diagnosed with the disease in 2013 at the early age of 34, after experiencing no symptoms and having no family history of ovarian cancer. Upon being diagnosed, I began to search the internet, and I noticed that none of the faces resembled me, a young black woman. It made me realize how important it is for all women to be represented and for all women to be knowledgeable about their health and how to advocate for themselves and what to look out for. That's why I'm excited to introduce Tina's Wish Empower Her series. These webisodes will cover a variety of fascinating topics with top subject matter experts. The goal is educate and empower all women, regardless of race, age, location, and social and economic status. There are no boundaries. So let's embark on this journey together towards greater awareness about our health.
Hi, everyone, and welcome to the fourth webisode of the Tina's Wish Empower Her series. Be heard, how to advocate for yourself as a patient. My name is Elle Simone Scott. I am executive editor and food stylist at America's Test Kitchen and also an ovarian cancer thriver. For those of you who are new here, Tina's Wish is dedicated to funding groundbreaking research for the early detection and prevention of ovarian cancer, as well as educating women about their gynecologic health. Before we get started on this important program, I would love to give a big thank you to our sponsoring partners and community partners. We're honored to join forces on this program and provide critical information about what to ask at your next doctor's appointment and how to be a fierce advocate for yourself. As you've heard, the goal of EmpowHER is for all viewers to walk away with a new toolkit of helpful knowledge. The EmpowHER webisodes cover many interesting topics about gynecologic health, feature subject matter experts. We offer closed captioning in English and Spanish and are 30 minutes. To view closed captioning, click the English and Spanish button under the live stream on the event website. This is an inclusive journey, and we're honored to have all of you here with us. Before I welcome our amazing panelists, I wanted to share more about my own journey and why this program is so important to me. I was diagnosed in 2016 with ovarian cancer. For at least 2 years prior to that, I was experiencing a lot of pain and a lot of discomfort and experienced also 2 misdiagnoses. The only reason I have survived this long is because I was a fierce advocate for myself and would not relent unless I got the answers that made sense to me. And that's when I got in 2016 at Dana-Farber Cancer Center. Now I'm pleased to welcome and introduce our panelists. We have Dr. Leslie Boyd, a gynecologic oncologist and director of Gynecologic Oncology at NYU Langone's Perlmutter Center. We also have Dr. Lindsay Kuroki, a gynecologic oncologist and associate fellowship director of Gynecologic Oncology at Washington University. I'm excited to have both of you here. Dr. Boyd, let's start with you. I know you heard Tina's Wish was covering this topic. You were eager to speak. Why are you passionate about self-advocacy, and how would you define self-advocacy?
Hi, Al. Thanks for the great question. Um, I do feel passionate about these issues, so I was very excited to be here today. And I want to thank the Tina's Wish team again for inviting me. I think self advocacy has a lot of different meanings to different people, but the way I think about it is patients need to be in control of their own healthcare. And so self advocacy means being confident enough to advocate for what they need to maximize their own health and for themselves, really, and often for their families.
Very true. Very true. Dr. Kuroki, do you have anything to add? And why are you passionate about this topic?
Yeah, thank you. I really think women need to understand they have a voice, and that voice is valuable. And one of the meaningful things about this opportunity to talk today is to help shed light on how we can allow individuals to engage in our healthcare team so that together we could help make best decisions on behalf of our patients.
Hmm. I think I've grew up feeling like having conversations about our bodies as women was slightly taboo. You know, it was almost something that you only spoke about in like company, right, with other women. And I don't think that that left us feeling very empowered to go into a doctor's office or hospital and say how exactly we're feeling. So I'm very excited to have this conversation. But I think the alternative to that, though, is that women feel often empowered in many other spaces, but not so much so when it comes to healthcare. So I'm excited to hear what you all have to say about this today. Dr. Boyd, how can women, not just those facing cancer, educate themselves in relation to their gynecologic health and in turn become better advocates for their health?
That's a really good question. I think it goes a little bit back to what you were talking about, is that we have to be more comfortable with our own bodies. And that starts from things, really early on in our upbringing, right? Not everyone is comfortable even thinking about gynecologic organs, right? So at the beginning of all of my my discussions with my patients, I bring kind of a basic visual guide, and I'm always amazed at how many educated smart women are really not aware of their own anatomy, right? And so we are in a such an information world now, and so there are any number of ways to just Google what's going on, right? And I think part of it is just getting over that sense of hesitancy, and kind of prudishness that some of us are brought up with, right? That we don't talk about this. But if we can't talk about this to ourselves, kind of behind closed doors and with our friends, our girlfriends, then we're certainly not going to be comfortable talking about it with our physicians potentially. So I think it starts there. I think we need to get more comfortable talking about GYN cancer and GYN issues, right? And I think it goes beyond, we're used to talking about our periods, but it goes well beyond that, right? So I think we just have to become more comfortable with our bodies.
Organs are not something that as an individual you would know where they are. You might not know when you're getting an exam done if people can feel them or not. And so I think one of the interesting ways that people can learn more about their bodies, and to start speaking freely about their vaginas, the cervix, the uterus, the ovaries, the fallopian tubes. It's like when you're getting an exam done, just like as if you were getting your breast exam done, to learn about these tissues, to learn what it feels like when someone is touching the cervix, or to honestly, a lot of times for our adolescent and pediatric gynecology patients, I was trained by a really amazing mentor who would bring out a mirror and show them exactly what the areas that we were going to examine together. So it's not threatening. And I think doing that together with your physician can be very enlightening, because that's an opportunity where you can ask questions about, organs and tissues that you just normally wouldn't, it's not common sense to know.
Ah, so true. Hopefully, we're bringing through another generation of more confident, comfortable young women who will lead that charge. Dr. Kuroki, I know you see patients who are facing a cancer diagnosis, but what important questions do you think all women should be asking their gynecologist or internist at their routine visits?
Yeah, that's a good question. Oftentimes patients, they might just be seeing them as a scheduled, annual exam. So, one opportunity in a year to have face to face time with their physician. So, I think it's an opportunity to ask actually at the very start of the conversation, any problems or any symptoms, any concerns that they may be experiencing that are new from their baseline. Because I think oftentimes, patients are coming in and expecting maybe the physician to like lead the discussion, or they're expecting that the physician has an agenda already lined up. And to make sure we prioritize what patients need to tell us their concerns. A lot of times we ask them to write it on a piece of paper, but it might just be a quick glance and then, a missed opportunity. So I would say first and foremost, ask about like, what are we going to be doing today? But then, speak up and say, one of the things that I'd like to talk about is this new problem I'm having, and I'm really worried about it, so that the physician could then make sure there's enough time allotted for that conversation to evolve. I think the other thing that's really important is just a simple question of like, what can I do to improve my health? Sometimes we don't even know what's expected of us. And I think asking those questions, which sound very basic, could be an opportunity to initiate the conversation and gain advice from the physician about what they perceive are their risk factors, available screening that they're eligible for, to reduce the risk and to improve their lives.
Wow. Throughout my cancer journey, I got some good advice, right? One was, if you experience anything for more than 2 weeks, you should mention it to your doctor, right? That's something that if I was never told, I probably would not have thought of. But I also know that sometimes when we come in, we're dealing with so many different side effects from so many different things. We don't know like what's problematic as versus what's natural. And sometimes we feel silly. Like, am I being redundant? Am I complaining about something that's small, or is it small? And then I know I tend to think of like the grand scheme. I'm like, well, I mean, I'm certainly not in as bad a position or as I was a year ago, or things could be worse. Maybe I shouldn't be complaining about this little thing. So it's very comforting to hear you both say, that as our care providers, you want us to speak up more, and you want us to even say the little things, even if it feels little to us. That is very, very comforting. I do it anyway. I'm pretty sure I bombard my team with all the little, like, my toe has been hurting for 7 days. So, I don't miss a beat with them. But I've always been a very fierce advocate. I was raised to always advocate for myself in every way. So, I recognize everyone doesn't have that privilege, and so I want to say from both sides, thank you for giving us that green light to do so. And this question is kind of a second part to that first question, but what can women do if they go to their doctor and do not feel they are being heard and or that their concerns are not being taken seriously? I was misdiagnosed twice. What would you recommend to someone possibly having this experience or any other that is related?
As a GYN oncologist, it's very likely that I might be the third or fourth physician that this patient is seeing. And I think in part of that, there's a lot of relief in finally finding a specialist who will then take them on as a patient and gain more trust to develop their management for cancer. But I also think it's such an overwhelming feeling, and there's oftentimes I think the scenario you paint is very common, that there's maybe an opportunity where the patient could bring a support person, because not everything is going to be displayed in a way that would just make sense in that moment. Maybe to have a support person there, a friend, a family member, someone that would be reliable and supportive to maybe ask a question when patients are feeling overwhelmed. And I think the other thing is that it's expected that we can't cover everything, and I would suggest like writing things down even after, and then even if you didn't have a support person with you, then asking for another appointment, asking for more time, because I think oftentimes it's a matter of making sure our communication is as clear as it can be. But if at the end of the day you give it a try, it all boils down to trust. And I think, one size doesn't fit all. And I think if you really don't feel that gut feeling of trust with your physician team, then it's also reasonable to get another opinion as well.
Well, thank you. I'm glad you said that because that kind of rolls right into my very next question for you, Dr. Boyd. At the time of a gynecologic cancer diagnosis, what questions should a patient be asking? And how can patients learn more about their diagnosis from reliable sources, especially with all the misinformation on the internet and sometimes even from well-meaning friends? Like what questions should we be asking and what sources should we be seeking for answers?
Yes. So, again, great question. This also goes back to what Dr. Kuroki said. By all means, when you are going in to speak to your physician about a new cancer diagnosis, please bring a friend or a family member for support, because there's so much information that needs to be imparted, and it's really likely that you'll be overwhelmed. We know as physicians, as soon as we say the word cancer, pretty much everything else gets tuned out, and it's really hard to focus because your brain just starts spinning away, completely understandably. So please bring a friend. There is so much to find out. What is the stage of the cancer? What are the grades of the cells? What specific cancer type is it? What's the primary treatment that you suggest? Are there alternatives to this? Eventually, you're going to want to hear about prognosis, like how am I going to do? How is this going to affect my life? But you may not be ready for that much information at the initial discussion. There are good, excellent websites actually available. The American Cancer Society keeps an updated website that I often refer patients to. The National Institutes of Health, PDQ, also is an excellent resource, up to date and reliable. I caution everyone about randomly Googling on the internet. And I remind them that the internet is for people who are really happy and really sad. It's a bit of an
Yes.
oversimplification, but most people are kind of in the middle, are just kind of going on with their own life, and they don't have time to post as much, right? So you're often getting extremes of the situations, and that may not be helpful. And in regards to well-meaning friends, everyone knows someone who had stage 4B cancer and it was miraculously cured by sunlight. I mean, I'm being facetious, but we have all heard this, and I think people want to be helpful, but they are rarely. It's not everyone in your circle is capable of true empathy. And so one thing I tell my patients all the time is figure out who you need to keep in your circle, and then designate one of those people for all the others, right? And you tell them, so you can't, because you don't want to be the clearinghouse of misinformation. It's not your job, and you've got better things to do in this really challenging time. So absolutely. So I try to manage that from the beginning, because it becomes a significant source of distress for a lot of my patients.
It does. I've learned not to go down the Google MD rabbit hole, but I did join some support groups. The National Ovarian Cancer Coalition is a group that I'm a huge supporter of, and also volunteer. Right, volunteerism always feels very nice because you get to be with people who share your experiences, and so many others. But I definitely have found getting in touch with support groups has been helpful for not only my emotional health, but my physical health. There are lots of resources behind those groups. They offer meals that can be delivered to your home, care bags that can go with you to treatment, someone who can just support you and talk you through. It's amazing. I think getting support is always really good. And it also helps when your well being friends well-meaning friends say things that are kind of a little off, you take it a little lighter because you have a better source. It doesn't really throw you off. So that's really great. Thank you so much for that. Dr. Kuroki, I want to ask you, someone facing a gynecologic cancer or other life-threatening disease can be experiencing a very scary time. What advice do you give your patients as they begin their treatment journey and decision making?
Yeah, I think you sort of nailed the key word of that. This is a journey. It certainly is a life changing, not a sprint. It's more of a marathon. And I first and foremost tell my patients that I'm in it. I'm in it with them. But I certainly acknowledge that it is a stressful time, and sometimes we'll be faced with decisions that might not have an obvious right answer, but the right answer would be what is best for the patient. And so I think, especially those patients that I feel like are really struggling um, to grasp kind of even next steps and are having a lot of anxiety and fear about going through this journey with me, I really start by just taking a step back and just acknowledging everything that they've been through up until this point, because it hasn't been easy, and it's been all consolidated and probably on the order of several months that all this workup has been done, but acknowledging three important time points that I believe bring on the most stress. And the first is when they have already first heard about there may be the possibility of cancer, and they're going through the whole workup of testing and imaging, biopsies even, and just that wait time to get an answer is really stressful. The second time that I think really hits hard for patients is that once they have the diagnosis and then they're right about to start treatments, just the anticipation of like, am I gonna feel okay? Am I going to come out of this okay? What does the day to day look like for me? What impact does it have on my job, my family, and just the amount of mental capacity to be able to put one foot in front of the other? I think is very hard when people start treatments. And then, ironically, that third point that I really emphasize for patients uh, is actually when they're done with treatment. And then for many that we're able to celebrate and say that their scan is clean and they have no evidence of cancer, and they transition into survivorship. That I think is also a really ironic time when people feel like they should be so excited and really happy. And in fact, they might be very scared. And, appointments tend to get spaced out at that time. You don't have that consistency in seeing your oncologist. So right at the beginning, I really try to establish trust, let my patients know I'm in it with them through this journey, but that I will always be honest with them. I will be honest with them when we're gaining results that we hope to gain through treatments. But I always tell them at the beginning, I will be honest with them also when I think outcomes are not as what we had hoped for, and that we need to take a step back and think about the goals of our care together.
That's a very honest answer, Dr. Kuroki. Thank you for that, and we appreciate the thoughtfulness and how you approach our care and every step that we go through along the way. That was very intricate and much appreciated. Thank you so much. Dr. Boyd, one more question for you. What do you think women should look for when selecting a gynecologist? And if a woman is diagnosed with cancer, what qualities do you think she should look for in a gynecologic oncologist?
All right. Okay. So I think you should be when you're looking for a gynecologist. These are qualities you want in your general practitioner as well. So first and foremost, I would suggest that people look at finding a board certified gynecologist, right? So there are minimum standards set up by the College of Obstetrics and Gynecology. And if you know that your gynecologist is board certified, then they meet those minimum standards, right? And that's in terms of clinical knowledge and ethics, actually. So that's a good first step. It's just the first step. After that, I would look for recommendations from friends and from your general practitioner. And then you're going to look for the right fit. So again, things that we were talking about earlier, you want to make sure someone has kind of the clinical chops to take care of you, but also is inclined to listen, right? So finding someone who's going to listen to you, to take all of your issues seriously, and to really spend the time you need. So not always easy to find, but certainly worth looking for. I will say they've done studies. Those Google and Yelp reviews are actually
Mhm.
often not far off. So you can use those, as a first pass. Right? If you see somebody with 1 star, that's probably not good, right? Probably
Probably,
not. So,
probably.
and then if you have cancer, a gynecologic cancer, it is really important to look for a gynecologic oncologist. So gynecologic oncologists have specific training for women with GYN cancers that involves surgical training as well as training in the chemotherapy required for treating these diseases. So finding a gynecologic oncologist should be relatively easy in major urban centers. It's a bit harder in rural areas. Again, you want similar qualities in a gynecologic oncologist. We are also board certified. Again, we're providing minimum standards in kind of what we do, and then after that, really, you want someone who's the right fit. Um, and you are usually referred to a GYN oncologist by either your general gynecologist or by your primary doctor. So you can ask them, if they say, all right, you can go to these 3 people, say to them, hey, you know me. Of these 3 people, who do you think is the right fit for me? And kind of try to tailor it from that. We all also have websites and other ways that you can try to get to know us in a kind of quick way. And thankfully, my institution has a video that I shot actually, and I'm surprised at how often a new patient will say to me, "Oh, I saw your video, and I knew we would get on." Which, and
You knew you
I
were.
hated shooting the video. It was the most awkward thing ever, but it worked, right? So it's just anything that can give you a sense of what someone's really like, just so that you have a
Mhm.
sense of, is this someone I'm going to be able to bond with in this major event in my life?
Yeah, I was referred to my gynecologic oncologist from my gynecologist. They went to Harvard together, and either she was his mentor or he was her mentor. But they had a very close working relationship, and she felt extremely confident. And that was actually good for more than just having a good referral, but it also helped my process to happen more quickly. I didn't wait a lot of time between um, having an ultrasound and knowing that I had a cancer that I had a cyst that had cancerous characteristics, and then seeing the oncologist. That literally was less than 15 days. So I was really pleased with
That's
that.
great.
And I use ZocDoc. I use all the other apps where I can read reviews. Like I think it's lost on a lot of people that you don't have to take the very first physician that's in the catalog that comes from your insurance provider. You can do your own research. You can ask friends. And I actually ended up finding my gynecologist through my coworkers at my brand new job when I moved here to Boston. And I was searching at that time before I knew that I was going to be dealing with ovarian cancer. I wanted a doctor who specialized in women who were over 40 who wanted to have children. So I based it upon my goals, like what I wanted from my life. And that was also very helpful.
Can I make one
Um,
more point, Elle, before we move on? Um, I would make sure that whoever you decide to go with, make sure that they have enough experience in whatever it is you need. So, for example, if you need ovarian cancer surgery, make sure that that's something that they're comfortable with and that they do often enough, because volume does matter.
Yes, it does. That's excellent advice. Thank you so much, both of you, for really answering these questions so deeply and so thoroughly for us. I think right now we're gonna take some questions from the audience. They've been coming in swiftly, so I have a couple here already. The first question is, what do you do if a doctor dissuades you from seeking a second opinion? What if we make them mad? What do we do?
Yeah, I personally think that's a pretty big red flag. So if somebody is really, again, if someone's looking for a fourth and fifth opinion, then to me that's a form of kind of denial and wasting time. But a second opinion is completely reasonable. And anyone who's really making you feel uncomfortable about getting one, that would make me want to get one a lot faster.
Yeah, me too.
I will say that I do feel for patients who are geographically restricted. Right, so I happen to practice in New York. There are many wonderful GYN oncologists here, so people can take their pick. But if you live in a rural area and you don't have a choice, well, then second opinion isn't the answer. It's really advocating more forcefully for yourself in the practice that you're in and being honest with your provider and saying, hey, I'm not feeling heard in this space. And I will say that most physicians, just like most human beings, when you point out in a need, respond with empathy, right? And I would hope that a physician would be the same, right? So if you're not getting what you need from your doctor and you don't have a choice and must stay there, then go to them in an honest, open way, explain what you need, and I suspect you will get back more than you expected.
I think that's great advice. And in the culinary world, we say too many cooks spoil the pot, and in this case, too many oncologists make life sweeter. So we'll go with that. All right, one last question, really quickly. How can caregivers be better advocates for their loved ones?
I really like that question. I think caregivers, caregivers are so important to our patients' journeys and lives. And so I'm so thankful, for, I consider this a team. We're a team together, and it's not just me and the patient, but it's certainly their family and their support. Um, but, the one thing that I often see is that sometimes the team members, instead of just listening, they're trying to, they want to fix everything. And not everything can be fixed. And that's, one of the hardest parts of all of this. And I think being able to really listen is priceless. And it's not easy. But if they can be present with their loved one and really listen to what they need, that's kind of the most important gift they can give.
Wonderful. That's really really great advice to caregivers, and lots of hugs. We appreciate those hugs. And don't make it about you. That's my other really solid advice, right? Don't make it about you. Well, now it's time to wrap up. A huge thank you to you, Dr. Boyd, and to you, Dr. Kuroki. We really, truly appreciate your time and all that you do to improve the lives of women and our families. We thank you so much. And a big thank you to all of you for tuning in and for your incredible support of Tina's Wish and our other initiatives. If we didn't get to your question, don't sweat it. The Tina's Wish team will address any unanswered questions in the follow up email blast. And they're going to send out early next week. So no worries. That email will also contain a full recording of this session, a link to the podcast version, and additional helpful resources. So stay tuned to hear more information about Webisode number 5, which will air in the spring. Be well, and take care and be your own best fierce advocate.